I have decided to study the academic case study over a young adult that is a Jehovah's Witness with severe sickle cell anemia. The girl they are studying, referred to as TH, is a Jehovah's Witness. As a Jehovah's Witness, they believe that it is against the Bible and is a sin to accept blood in any form. Blood is only acceptable when it is shed for sacrifice because of sins. She recently turned 18, which means she has every right to medical choices because she is legally considered an adult. This means that her parents can't make any decisions without her input and don't have any control over her and her medical decisions. Her heart is eventually going to fail due to the fact that she cannot receive a blood transfusion. If she doesn't receive a blood transfusion, then she will die. Her doctors obviously don't want this to happen to her. The girl and her family are refusing the blood transfusion while the doctor and the care team are supporting the blood transfusion. They're trying to agree on a treatment that would work to save her life. One of the options of treatment is to use birth control or estrogen to prevent TH to lessen the risk of losing iron deficiency from the young girl being on her period in her menstrual cycle. Physicians could also experiment with the young girl to see what other methods there are to save her life, considering they had done this with other adult patients who had denied blood transfusions. These experiments have only been tested in children, but should certainly be available to adult patients in this case. In this situation, it would be useful to talk about the case study with a doctor from a bloodless program. These are clinics that have knowledge on treatments of Jehovah's Witnesses who have refused blood transfusions in the past. The care team should also be able to respect the patient's decision, considering they always have patients' rights. It is also important to know that the patient is psychologically and physically able to make their own decisions, which is vital in this situation. The care team should also make sure that her decisions are not influenced by her family, friends, or her religious views, which could sway her ultimate decision. Her and her family would also need support therapy because her decision could play a factor in the relationship. They also need to be educated on the advantages and the dangers of the blood transfusion with or without it. The care team should also ensure that TH has a person she can rely on and talk to and be able to trust with her decisions. This person is usually a social worker or a therapist. The first doctor is Wynn Morrison, a pediatric intensivist, a bioethicist, and a palliative care physician from the Children's Hospital of Philadelphia. He made a statement about having a right to refuse medical therapy. On a 2013 article titled "A Young Adult Jehovah's Witness with Severe Anemia" by Pediatrics says, adults with decision-making capacity have a right to refuse medical therapy, even if the therapy is thought to be life-saving. This standard applies to Jehovah's Witnesses who would rather die than receive blood transfusions. The doctors have to respect the patient's decision whether or not they think it is medically correct or not. They are only allowed to refuse a patient's decision if they think they are mentally impaired, like suicidally depressed. He also mentioned that in children it is common to transfuse pediatrics whose parents are Jehovah's Witnesses when it becomes absolutely necessary. This always causes controversy. They are able to justify giving the child a blood transfusion because the child may choose that receiving one is acceptable as they get older. Some doctors are stressed out about allowing a child to die because of the lack of receiving a blood transfusion, because it's so common in American culture and society. It is also mentioned that a 16-year-old has more respectable decisions than a 12-year-old does, depending on if they are more mature. The doctors also have to ensure that TH knows the consequences if she refuses a blood transfusion. She also has the opportunity to privately accept the blood transfusion without disclosing the decision to her family or other Jehovah's Witnesses. Some Jehovah's Witnesses have accepted the procedure without consenting to it. If she is given the opportunity to plan ahead, her physician may have told her that he has sympathy for her and her disease. He also may have told her that if she doesn't want to continue having blood transfusions after turning 18, then she'll need to write a letter to him expressing her decision. If she does not write a letter or find another doctor, then he will know that she is passively agreeing to accept the blood transfusions. The care team must make sure it is legal to treat her in the state. If she does decide that she doesn't want blood and she dies, the care team may need emotional support. This is a perfect example to anyone in the medical field to remember that we should remember not to become too attached to patients and must always respect their decision. The three doctors from New York Medical Hospital, Nina Yukachi, Samantha Van Horn, and Revati Sundaram, all agreed that the blood transfusion is the most studied and common therapy for many complications of anemia. In the 2013 article titled Pediatrics says that other alternative therapies cannot be ruled out, especially when the transfusion is prohibited. They could have used erythropoietin and hydroxyurea to save the young girl's life. According to John D. Lantos, a pediatrician from Children's Mercy Kansas City Hospital, says that we need to prepare ourselves as nurses to prepare our patients from transitioning from childhood to adolescence to adulthood. In the 2013 article called A Young Adult Jehovah's Witness with Severe Anemia by Pediatrics, it says that patients should be preparing to make their own medical decisions before they turn 18 and are legally considered an adult. It says that if she was prepared to make her own medical decisions, she wouldn't have had to wait until his life or death to make this decision without her parents' influence. He also mentions that adults still make bad decisions even when it comes to medically related. They may choose to die even when life-saving treatment is available. For example, a cancer patient may refuse chemotherapy or radiation even when it is proven that it has a very good chance of saving their life. We shouldn't abandon the patient even when their decision is a huge problem morally. The result of this case study is that she unfortunately died from not receiving the blood transfusion. If she was more prepared to make her own decision, this wouldn't have been the result.